Dan Hendricks. I'm the owner of the Health and Wellness Clinic and Layton Chiropractic Clinic here in Layton. One of the amazing and exciting new additions we have to the Health and Wellness Clinic is the Chill Out Cryotherapy. If you've heard about cryotherapy, it's exactly what it sounds like. It's very, very cold. Cryo stands for ice, or cold in Latin, I think. And so the cryotherapy is a wonderful treatment to help inflammation, chronic inflammation especially. It was started back in the 70s in Japan for people with rheumatoid arthritis and other kind of chronic arthritic problems. But it's been so effective that we decided to use it in the clinic here. So I'm going to kind of demonstrate how things work, and you can be in there, or you can watch while I'm in the cryo. Now, as I'm in a robe, I'll step into the chamber in a minute, and I'll have my underwear on and socks and slippers on. You can show the socks and slippers, socks and slippers on, just down there to kind of. And then I'll put some gloves on here in a second after I hand over my robe. In fact, you can grab those. Now I'm going to do a little bit of a pre-freeze. Right now the temperature on it is about 29 degrees. And I'm going to start with about minus 100 degrees. I'll start in there. Now you'll notice you can hear the sound. These tanks I have here are nitrogen tanks. Nitrogen is great because the air we breathe is 78% nitrogen. So it's very safe. It's not toxic. You know, you don't want to put your head down there and suck it in. It'll make you lightheaded, but it's not gonna bother you. You can see this vapor that comes out as you're in the chamber. If it bugs you, you can kind of brush it out or blow it out of the way. So once it gets up to minus 100 degrees, I'll step into the chamber and we'll continue on with the therapy. It will linger around minus 250 for most of the treatment, and you're in there for 3 minutes. 3 minutes is the max. So I'm going to go ahead and step in here. Okay, I'm turning over my robe out to the assistant. I have my gloves I'm putting on, and it's very, very cold. People ask me all the time, what does it feel like? What does the cryo feel like? It's uncomfortably cold. But the amazing thing is how much better you feel afterwards. How much more energy, at least me personally. Now, the biggest reason that I am such a fan of the cryotherapy, for me personally, is because I have multiple sclerosis. I have MS. And it's one of those arthritic autoimmune kind of diseases that this really seems to make a big difference for me. I feel more energy, I feel less pain, because MS can be very painful sometimes, but I can function and move better. You know, my job as I'm here treating people all day long can be very, very painful and wear me down, but this really helps. So I go on the cryotherapy 3 or 4 days a week, at least, some days every day, but it really, really helps me. But I have a lot of people that come in that are just having a hard time with some soreness or some arthritis, and we have a lot of athletes. You can see our athlete wall over here. We have a lot of athletes that come in from high schools and colleges, and some Weber State athletes, and basketball players, and football players, and volleyball, and soccer players, and so they come in, and it really helps after a big workout. It really helps because when you have a big workout, there's so much inflammation that comes on. This really helps that inflammation. And the great thing about the cryotherapy is when you come out of this, you warm up really quickly. All the blood is rushing to my core. So I'm in here, and it's minus 249 degrees that you see there. When I'm in here and you can see how cold it is, all that blood is rushing to my core. So I'm not short of breath. My heart's not beating 1,000 miles a minute. I'm cold on my surface for sure. It's very, very cold, but it's very, very safe because all that blood rushes to your core. And but I really feel it on my arms and my calves and my legs, all on the surface. But when I come out of here, I will warm up really quickly because all that blood will rush back out, and that change of that blood flow really has an effect on the toxicity, and it really kind of cleanses and clarifies things And with me personally with EMS, it really makes a big difference on that kind of parasympathetic, sympathetic nervous system, that fight or flight system that really kind of wakes me up a little bit. I have a lot of patients that come in and talk about how much better they breathe, they sleep after the cryotherapy, and I've noticed that same thing as well. But a lot of people that have insomnia and have a really hard time sleeping, they do so much better with the cryotherapy. Now I'm going to come out here in a second. That was a quick 3 minutes, wasn't it? It didn't feel super quick while you're in here because it's very cold, but I'll come out and get dressed and I'll explain a little bit more. Well, I'm out. I survived and I feel great. You know, you feel a little cold. I feel it in my calves. I feel it in my arms a little bit at first, but you warm up really quickly. And I really do. I feel energized. I feel good. The great thing about the cryotherapy, I can remember back in high school when I played football and basketball, we'd have to go in ice baths. Our coach would make us go on an ice bath, and miserable. You get in an ice bath for 5 minutes and you don't warm up the rest of the day. With this, I don't feel bad at all. I feel you know, like I said, I feel still some cold on my surface, but 5-10 minutes from now, I can go back to normal activity. Not even that long, 2 or 3 minutes from now, I can go to normal activity. I have a lot of athletes that do just that. They'll come in and get the cryo that morning and then have a big event or something that night. There was even a story last year where one of the quarterbacks in the NBA or in the NFL, he was injured in the first half, went at halftime, got cryotherapy in the locker room, and came back in the second half and came back from a deficit and won the game. There's a lot of athletes that use cryotherapy. LeBron has one at his house, and Michael Phelps has one at his house, and you may have heard what's his name, Antonio Brown, this dingbat for the Steelers. He's not with the Steelers anymore. He had a cryotherapy at home, and he was soaking wet. He went into the chamber wet and gave himself frostbite. That's a no-no. You don't ever go into one of these wet, and that's why we give you new socks to put on. You wear nice warm robe, and you're not wet at all, because it will kind of freeze any moisture that's on there. But it's very safe and it's very effective. So here at the Health and Wellness Clinic, we invite you to come and try our cryotherapy. The first time visit is only $20, which is a great price. And then if you come in and want the cryotherapy as part of an adjustment or a massage or one of the other therapies that we have here, it's going to be $20 then as well. And then we have passes, like 5 punch passes or 10 punch passes, those kind of things that really a lot of people choose to do, and it works out great. So we hope you come give us a try and try out the cryotherapy. It's a once in a lifetime kind of thing, but it really does help. So good luck. Thank you. We'll see you soon.